Let her roll.
Muted.
Hi, everybody. I think we'll give it another minute. It's just 11 right now, but if you're joining us, we are very glad to have you. And we'll get started in just a second and introduce everybody to the panelists and to the platform so that we can take your questions and answers throughout. I do sometimes want to have a little like, let's go to the movies preview going, just a little song and dance while everybody logs on and gets their last cup of coffee. Reminds you to mute your phones. Brian, just want to make sure we are seeing people log on. Oh, good. Thank you. Cool. Out of respect for the time of the panelists and the people who are logging on, welcome. Thank you so much for joining us. This is National Kidney Month, and so we're focusing our Chronic University this month on kidney health and what the landscape is for patients, both in terms of care and people's experiences and in terms of policy. So we've got a great panel we have a great panel already, and we'll have an assembly member joining us later from California to talk about some legislation that he's got sponsored in Sacramento. It's just an example of the kinds of protections that we can support in all states in the country. My name is Mary Kay Clunies-Ross, and I'm the Executive Director of the Chronic Disease Coalition. Our goal today is to illuminate the experience of kidney patients and discuss how public policy solutions can help address the problems that kidney patients are facing. We do this format because we want this to be a conversation. So please use the Q&A function or the messaging function, the chat function, to let us know if you've got some questions. We also absolutely have time to open up the floor for other people's experiences. Kidney care is a complex set of care, both in terms of patients being complex and in terms of the care options. And so we want to help folks understand some of those things. Before I introduce the panelists, I just want to give everybody a little bit of the scope of the problem that we're facing. According to the National Kidney Foundation, 37 million adults in the US have chronic kidney disease. Unfortunately, most of those don't even know it. 1 in 3 Americans is at risk. Early detection can help stop kidney disease from turning to kidney failure, but that takes a lot of vigilance on our part as patients. There's a couple of diseases that lead to, or conditions that lead to chronic kidney failure and disease. And those include diabetes and high blood pressure, also known as hypertension, are responsible for about 2/3 of the chronic kidney disease cases, but certainly not all of them. We know already that COVID can really damage our internal organs, and we don't know, what they might do in 5 years or 10 years after exposure and after disease, COVID disease. So it's going to be an area that unfortunately we do think that we'll have to be paying attention to. Both in terms of managing the health of patients and managing the cost of the disease treatment. So a lot of folks don't even know what increases their risk for kidney disease. Diabetes, as I mentioned, high blood pressure, a family history of kidney failure. If you're older, if you belong to a population group that has a high rate of diabetes or blood pressure, such as African American, Hispanic Americans, Asian Pacific Islanders, American Indians. As you'll hear from our panelists, those aren't the only reasons. One of our panelists, Gil Dong, who received a kidney transplant, and manage lupus for much of his life. And so other diseases can trigger kidney failure as well. So we want to talk about that and some of the challenges that are therein. So I will take a deep breath, and I'm so happy to have the panelists. I'm going to have them introduce themselves because I think you'd rather hear from them than from me. But I'll just call them on them to do everybody in order. I'd like to start with our patients and start with Elizabeth Oldham, who's one of the CDC's ambassadors. Elizabeth, could you talk a little bit about what brought you here and a little bit about your disease path and what you want people to know and understand about kidney disease?
Yes, thank you, Mary Kay. First, I'd like to say that I'm really glad to be here today, and if I can help someone with what I experienced, that would be really my intent. Well, I am a kidney patient, but before I became diagnosed with the kidney disease, I was a caregiver for family members that had chronic diseases, diabetes, hypertension, that led to kidney disease. Unfortunately, they didn't have access to early detection and they crashed into dialysis. So that experience led me to start volunteering with kidney organizations. Later, I found out that I had kidney disease, and then I started to become an advocate because I wanted to bring awareness to early detection and education, and to make people aware that kidney disease is really a silent killer, that people aren't aware that they have kidney disease until they crash into dialysis.
That's a great perspective. Thank you. And that already made me want to ask a few follow-up questions, but I'll hold them for just a few minutes. Gil, could you talk a little bit about your story and how you ended up here?
Thank you, Mary Kay, and thank you to the coalition for inviting me to share my story. I am a kidney transplant recipient, going on my 4th anniversary on April 4th, in which I needed to get a kidney transplant because my kidneys failed due to the complications of lupus, which is an autoimmune disease that affected my kidneys. I was diagnosed in 2001 with lupus and was able to manage it for 16 years through medications and healthy diets. But unfortunately, through that length of time, my kidneys ended up failing. Part of the process of recovery was I had to go through 4 months of dialysis. And during that time period, we started a search for a kidney donor. So I was fortunate enough to have 14 family or friends sign up to be a donor. And the first one who went through the testing process, who was a longtime friend and a colleague of mine, we both served as paramedics and EMTs in the early 1980s, and then we ultimately became paramedics and then firefighters for different agencies. I think having the opportunity, and what I want to share on this forum, is the access and information about getting kidney transplants and how people can save a friend or a loved one by donating a kidney. So that's what I would like to do with this forum.
And Gil, I think we had invited your friend and donor Peter to join us, but he's recovered, because where is he?
So Peter is recovered, and after donating a kidney to me, literally 6 weeks later, he was off to Spain to walk the trail, the El Camino trail out there. He's a photographer now, and so he travels around the world taking pictures. So he's living his full life despite giving me his kidney.
You went back to work, which we're all a little baffled by, but.
Yes, I did. I actually, when I had my kidney transplant, I had retired after serving 28 years as a firefighter and promoting to become fire chief for the city of Berkeley. During that period, I was also the interim deputy city manager, and I was actually doing both jobs at once, which I think some of that stress may have attributed to my needing additional kidney. But I was so bored, and my whole life has been about being a public servant. I went back to work. Now I'm serving as a labor relations analyst for another agency, continuing my public service life.
Yay, we're glad. And then I would very much like to introduce Deborah Darcy, who is with the American Kidney Fund.
Thanks so much. Thank you for having me. As you said, my name is Deborah Darcy, and I'm Senior Director of the American Kidney Fund. I got involved with patient advocacy when I worked for a member of Congress as a healthcare staffer. And even then, I consider myself an advocate for patients. So now I'm really excited to wake up every day and advocate on behalf of kidney patients. The American Kidney Fund, we fight kidney disease on all levels, and we help kidney patients from prevention all the way through to post-transplant. We have a number of programs for kidney patients. We have our Kidney Kitchen. It has over 400 recipes that are kidney friendly. We do public awareness campaigns. We have award-winning educational material on our website. And we are the only kidney organization that helps kidney patients with direct financial assistance grants. So really excited to be a part of the panel, and excited to participate and answer any questions.
Cool. Well, thank you so much, Deborah. We will definitely rely on your expertise during this conversation. I also wanted to recognize staff who's here. Brian Dorn, who's off camera, is making sure this all works. So if I miss a question, Brian will catch it and hit me on the head. And then we've also got Nathaniel Brown, who's our policy director. Nathaniel, do you want to say a few words?
Yeah, I'd be happy to. Good morning, everybody, or good afternoon if you're on the west or the East Coast. Like Mary Kay said, my name is Nathaniel Brown. I'm the Director of Advocacy at the Chronic Disease Coalition. And primarily my role is engaging with state legislatures on policy issues that are impacting chronic disease patients, and elevating the patient voice in that process, which obviously, during National Kidney Month, but all year round, there's plenty of opportunities to engage there and to support policies that will positively benefit kidney patients. So excited to facilitate a little bit of the conversation with Deb here in a few minutes.
Great. And Nathaniel, I don't know if you noticed, we've got a representative has joined our call. Representative, do you mind introducing yourself? So good to have you. Thank you for joining us.
Yeah, hi, this is Representative Titone. I represent District 27 in Colorado, and happy to be here with you today.
Great. Thank you so much. We are absolutely tickled to have you, and we'll be having, how long can you stay with us? I know time is short when sessions are going.
I've got a little bit of time. I think I can stay with you for a bit.
Oh, that's great. We'll be having Assembly Member Kalra join from California, I think about 11:30. So we'll definitely lean into some of the policy things there. But for right now, I think I'll take advantage of the fact that we've got some really great experienced patients on board. And I'm hoping, Elizabeth, if you wouldn't mind kicking us off, as a caregiver and a patient yourself, could you talk a little bit about what people don't know about kidney disease, or what you wish, more people understood? What have you seen out there?
Well, from my own experience and what I saw as a caregiver, and I also volunteer at 2 dialysis centers here where I live in Oldham.
Great.
So are virtually powerless. They need to know that they have to be their own self-advocates. They have to become educated. They have to be very vigilant in protecting their health.
Mm-hmm.
As kidney disease is a silent killer. The average person will probably succumb to heart disease before dying of end-stage renal disease. People just need to be aware. There needs to be more education about kidney disease.
Mhm.
You know,
Is that because the heart functions are weakened with kidney disease? Is that how that happens?
yes. When your kidneys fail, it affects all of your other organs, and the kidney and the heart and the lungs, that all works together. All of the systems work together. And when one goes down, the other goes down. If your lungs give out, your heart gives out. So people need to really be aware that they need to be conscientious of heart. If you guard your heart, you're guarding your kidneys.
Okay. And do you, and again, I don't mean to put you in the role of necessarily a medical professional, but as you talk to people about this, should folks be asking for certain kinds of tests, or is monitoring blood pressure sufficient?
First off, people need to understand the relationship between exercise and a healthy diet. Actually, I just recovered from COVID, and I had long COVID syndrome. Fortunately, it did not affect my heart, my lungs, or my kidneys. But my doctors tell me that the reason it didn't is because I had a strong immune system, which came from a lifetime of proper eating and exercise.
Mm-hmm.
So people need to know diet is very important. You got to start with the basics, which is your food. And you need to be very vigilant about your health. You need to see doctors routinely, and you need to ask questions about your tests. I see people all the time at dialysis centers. They never knew they were diabetic.
Mm-hmm.
They never they had hypertension. So these chronic diseases were never treated, and they ended up on dialysis. So you need to see doctors regularly. You need to be proactive about your own health. You need to insist upon the blood test and the urine test. That is one of the reasons I became an advocate when I found out that doctors give you routinely the blood test, and at 60, they'll say, "Oh, you got good kidney health," but you could, if you're at 90, you're already in kidney decline. People don't know this.
Right. Well, and I'm interested in, Gil, your story. You had lupus for 16 years, so you knew, was monitoring your kidney health a normal part of your care for your existing chronic disease?
Yes, and when I found out I had lupus, it started off with joint pain, and that's when I went to see a doctor, and they did the blood test and urine test, and they discovered that my kidneys were impacted.
Mm-hmm.
So through diet, exercise, that's how, and medication, that's how I was able to maintain for 16 years.
Mm-hmm.
When the kidneys start failing, a patient will start feeling very fatigued. And I was having a lot of fatigue, but I always thought it was to my irregular schedule and being up in calls in the middle of the night with my firefighting and my paramedics response. I think an important question, just following up with what you asked Elizabeth, is people's access to healthcare is important. We see that patients who have a lot of kidney dysfunction aren't getting the annual physicals. They may have poor eating habits or poor exercise. And so it's important to provide them that preventative healthcare education so they can get the screenings that they need.
Mm-hmm.
I think from a process of treating once your kidneys fail, going on dialysis is not a fun thing. I think For those who go to the dialysis centers, they have to do that 3 to 4 times a week for several hours a day in which their blood's exchanged. What I did was I did at-home dialysis. Essentially, they put a catheter into your belly, and you do the exchange of fluids at home. So you're provided a machine and lots of liquids and fluids that you're doing the exchange. That's a 10 to 12 hour a day process. So you're tethered. So if you want to travel, you have to take this machine and carry it with you on an airplane or in the car. And then you have your liquids, your fluids sent to whatever location you're going to. So it's not a comfortable process. And I had to do that for 4 months. And so having a kidney transplant allowed me to, one, live my life again, not be tethered to a machine, and not sit at home for 12 hours going through a dialysis process. So that's why kidney transplants really help those with kidney failure recover and live their full lives again.
Yeah, that's great. Thank you. Before I hand it over to Nathaniel to talk to the electeds, I was wondering if it would be okay, Deborah, if you would talk a little bit about sort of that question about dialysis and transplant. It's my understanding that a transplant is significantly less expensive overall to the healthcare system than dialysis, certainly at the frequency to which is needed, and the loss of the mobility to me seems like a huge cost to society as well, right? To have somebody as active and knowledgeable as Gil be stuck, tethered to a dialysis machine at home a couple of times a week seems also costly. So, can you talk a little bit about how you look at that?
Sure, absolutely. They're in Medicare because once you're on dialysis in this country, you're usually eligible for Medicare regardless of age. You just have to work your 40 quarters, but most people are eligible for Medicare regardless of age once they're eligible for dialysis. When they're on dialysis, Medicare pays about $90,000 a year per patient. Once they get their transplant, that costs go down to about $30,000 a year. So it's definitely better for Medicare, and it's better for the patient once they've gotten their kidney transplant. Also, when we look at drugs after in Medicare Part D, the immunosuppressive drugs cost about $6,000 a year. So it is, in terms of costs, to Medicare, it is better when somebody has gotten a kidney transplant. And also, as you mentioned, having a transplant, once again, as Gil had mentioned, you don't have to worry about going to dialysis anymore. So your life improves. You get your freedom back. You can travel, things like that. Gil was talking about peritoneal dialysis. If you're on hemodialysis and in center, you can work with your social worker if you want to travel, and they'll set you up with a in-center dialysis wherever you're going, kind of thing. You have to work with your social worker. Mm-hmm. But in terms of costs, getting a kidney transplant is, what most patients want in terms of addressing their kidney failure.
Yeah. Oh, that's super helpful. And this is an interesting conversation because we're sort of talking with, as Elizabeth was saying, is there's a lot you can do to prevent this. Is, exercise, careful monitoring of your health, good food choices. But then in terms of how we manage the disease and kidney failure once it kicks in, then we're talking about a different set of questions, right? That's not a personal thing that you have to do all by yourself. We need incentives, and we need some of the barriers removed to transplant. So Nathaniel, could you take it from here and introduce the electeds and talk about policy and how that helps?
Yeah, absolutely. So thanks, Mary Kay. We have been joined by Rep. Brianna Titone. I hope I'm pronouncing your last name correctly. who is a representative in Colorado, a champion of chronic kidney disease task force legislation that passed last year. And that's one of the priorities at the CDC as well, because like I mentioned earlier, obviously, a public policy response to some of these issues, to many of these issues, is the right way to go, and elevating the patient voice within some of those task forces is essential. And so, Representative, I'm hoping you might be able to talk a little bit about your support for that bill, the process by which you were able to get that through the legislature, and where it's at right now, because obviously the task force's work is ongoing. So I'll pass it over to you. Thanks for being here.
Yeah, well, thanks very much for having me here. It's a pleasure. When the bill was introduced, I wasn't an original prime sponsor. I saw the bill in the system, and as someone who myself has chronic kidney disease, it was something of a very big interest to me to make sure that I was a voice on the bill. I have hydronephrosis. One of my kidneys doesn't work at all. The other one is under control, but this was a problem that was ongoing for most of my life, and I didn't know about it. It wasn't something I was aware of. And I remember, I don't know, maybe 10 so years ago, my doctor said, "Oh, your creatinine level's a little elevated. Have you been drinking enough water?" And I was like, "Well, yeah, probably not." And he's like, "Okay, well, then that's fine." And it was just swept under the rug, and nothing was done to even follow up to see if there's anything wrong. So, you don't have a kidney completely stop working overnight. This was a problem that has been going on and was undiagnosed for a very, very long time because, as was said by Elizabeth earlier, this is stuff that sneaks up on you. You don't realize you have it. The symptoms are masked by a lot of other things. If you're working outside and doing things outside and just everyday life, you have some back pain or something, you never really detect it. It really has to be through the right things. So for me, I wanted to make sure that what we were doing in Colorado was to help the people of Colorado not get into a serious situation where they needed to be on dialysis or they needed to have a kidney transplant, because those things cost people a lot of money. And having the awareness and the education and the tools to be able to understand if they're a high-risk person or if they need to be aware of what the signs are, then we can help those people avoid getting into those crisis situations where irreversible damage is being done. So the Kidney Disease Task Force we put together really works with one of our university hospitals to get experts who are nephrologists and folks who are doing the research in this area to work with our state folks to put together ways that we can help to educate the people of Colorado about kidney disease, and hopefully we'll be able to make a difference in a lot of people's lives by eliminating the high cost, not just monetary costs, but the cost of having to live with a severe problem of dialysis and the transplant and the things that happen afterwards. So this is something to try to be proactive and make sure that the folks in Colorado know what to look out for.
Absolutely. Thank you. Like you mentioned, I think that education component is absolutely critical. And really resonates with us here at the Chronic Disease Coalition, which that's a large part of what we do is just spreading awareness and educating, in addition to our advocacy work. Assemblymember Kalra, I'd like to pass it over to you. I know you're working on a current bill in the California legislature around living donor reimbursement. This is a bill that I understand you're working with AKF on. CDC is supporting this. I'm actually hoping to get Gil's donor, Peter, involved. So if you want to just introduce yourself very briefly and talk about the legislation, that would be wonderful.
Well, thank you so much, Nathaniel, and thank you to the Chronic Disease Coalition for inviting me. So my name is Ash Kalra. I'm an assembly member in District 27, which is the San Jose, Silicon Valley area here in California. in my sixth year in the Assembly. I chair the Labor and Employment Committee. I also chair the Legislative Progressive Caucus here in the California State Assembly. And so let me talk a little bit about AB 2504. It's the Living Organ Donor Reimbursement Act. It is sponsored by the American Kidney Fund. And this groundbreaking piece of legislation would be the first in the nation to help reduce financial barriers for living organ donors. The bill would establish a reimbursement program in our state to allow living organ donors to recover up to $10,000 of out-of-pocket expenses incurred from organ donation. Now, typically, health insurance companies will cover general expenses associated with organ donation, but they don't cover out-of-pocket expenses. So we're talking about travel, lodging, childcare, or medications, for example. These are all expenses that a living organ donor may incur when making this life-saving choice. And I think we all can agree that they're already doing such a great service that we don't want to have them take on more of a burden to make the choice of being a living organ donor. California currently only has 3 laws that provide protections for living organ donors: job protected leave for private employees, job protected leave for public employees, and anti-discrimination from life, disability, and long-term care insurers. So although organ donors have these general protections, any out-of-pocket expenses can become, obviously a financial barrier to their decision. And we want to remove all those barriers. AB 2504 is a timely measure that will help encourage organ donations by removing those financial obstacles and allowing donors to be reimbursed for any additional costs associated with the life event. This is actually the second bill I've done in this space. In 2018, I did a bill, AB 3211, which had to do with advanced healthcare directives and to make the form friendlier and easier and simpler in terms of organ donation, because we found, especially the way that it was written before, was essentially in the advanced healthcare directive, if you said you wanted to be an organ donor, you essentially had to write what you were willing to donate, as opposed to the default being, if you're an organ donor, that you're willing to donate anything that is eligible, and then you would mark more specifically what you would object to. And so we essentially made the default much simpler in terms of organ donation, because the form folks just found it to be confusing. And what they ended up doing, because it was confusing, was just opt not to be an organ donor. And that's the last thing we want. We want to make it at least simpler and have people make educated choices. So the reality is that by this legislation this year and past legislation, we can help save countless lives by helping those that want to donate, and in this case, by helping those that selflessly become living organ donors in order to save a life. And so I'm very proud of this legislation. We're very hopeful that we can get it to the governor's desk this year, and obviously we'll appreciate any support that could be given by the community.
Thank you, Representative. I'm curious, and I'm sorry to jump in on Nathaniel's section, but one of the things that we try to do is help patients advocate directly with lawmakers. So could you speak a little bit to your experience of hearing from patients and having the patient perspective inform legislation and your approach on this?
Well, absolutely. Well, I'm sorry, was that for Representative?
Actually, both of you.
Okay.
Yeah,
Sorry,
that was my next question, Mary Kay. So.
Okay, so since I'm on mute right now, I'll just continue. I'll just say, absolutely. I mean, I think that this type of legislation, including in this case, comes from the experience of someone that received organ donation. So the reality is that oftentimes our legislation, the ideas not only come from the community and those that have either been donors or have benefited from donation, but in order for legislation to successfully pass, we have to continue to hear from the community, whether it's healthcare practitioners, whether it's those that have donated, those that have received donations. It's critically important as legislation goes through the process, as well as from organizations. I know there's a number of organizations that are participating today, or representatives of organizations. So we want those formal letters from organizations in support of legislation, in addition to individuals, especially those that have been impacted and that have benefited, or those that have donated, to lend their voice, because that's what allows for legislation. When we have thousands of bills, what makes it to the end, what makes it to the governor's desk, oftentimes depends on the advocacy from outside, what we say outside the building, outside the Capitol. We need to hear those voices.
Yeah, that's great. Thanks, Assembly Member.
Yeah, I mean, I echo a lot of the same things that was already said. We had several different bills other than my task force bill last year. We also had a bill for eliminating deductibles for people who are living donors. They were being charged deductibles for this. Like, that's absurd. And then also we had another bill that prohibited life insurance companies from discriminating against someone who's a living donor. People shouldn't be punished for giving the gift of life, essentially, to a patient. And we heard a lot of stories from people in the committees on all of those bills, really emphasizing their direct issue, like having to pay for those deductibles or having being denied different health insurance coverages. And, if you just really think about it, it's a really horrible thing for these people to have to go into, like thinking that they were doing something really great and then being punished for it in the end. We don't want any of that to happen. If someone wants to graciously give an organ for someone else, we don't want a barrier in the way. And we don't want people to be afraid that they're not going to get health insurance coverage. So all of those voices that were heard on all the bills that we passed in the last couple of years have been essential, as well as the organizational support to prove that these are really viable things. They're going to help save people money. Going to help get people to the table if they want to be an organ donor. That we welcome them and we're going to treat them really well and not be discriminated against.
Thank you.
Thank you both. It's really, really important work that's been going on in your respective states, and we're really excited to be supportive how we can. Rep Titone, I'm curious, as a kidney patient yourself, your perspective, and then kind of being a legislator as well. I mean, that's a very I feel like impactful voice on these issues. And I'm just curious if there's anything this year or you see maybe coming up next year that you might want to share, or if not, we can always touch base later in the year. But just curious if you have anything on the horizon that we might be able to work together on.
No, I would love to talk with you about some other ideas that you have. I definitely was talking to the Kidney Foundation about reaching out to me after the session. We're in session, unlike California. We only meet 120 days a year, and we're on the downslope of the last 49 days, but who's counting? So we're not thinking too far ahead as to what we're going to run next year, but we are at the same time. So happy to reach out, have you reach out and talk about some things we can do. It is very impactful when we have people impacted by those things be the spokesperson for those ideas. We are really fortunate in Colorado to have a member of our legislature who is in a wheelchair, and he runs a lot of the bills for the disability community because he lives that experience, and we should have someone who lives that experience be the person who's championing that because a lot of times those get put aside and not thought about. So, when we live those experiences, we bring a lot of those things to the table, and the more we learn about them ourselves. I mean, I've only been a kidney patient for maybe about 5 years or so since I found out about this. I'm still learning a lot about it myself and really starting to get steeped into what policy things we can do to make sure that we're really thinking ahead to keep our citizens healthy and safe.
Excellent. Assemblymember Kalra, I also pose the same question to you. Any kind of final thoughts? Deborah, I know I've got a few questions for you. I want to be sure to get to. But Assemblymember, do you have anything you're working on? Any final thoughts you'd like to share with this group of patients and of advocates?
Well, my final thoughts are similar to the representative, and she has her personal experience, and I have a staff member, Martin, who's a double lung and heart transplant recipient. And so when you have that kind of close connection with someone you care about, and it really, and especially someone that's on my team that's helping craft policy, I think that those connections and having people with lived experiences helping to craft policy is critically important. But also the partnerships, whether it's with the advocates and the organizations, or even right here, we have a Colorado, California connection now where I can see what's happening in Colorado. They can see the legislation we're putting forward. California is pushing this, the first one to do this. Colorado is the first one to do that. Well, the reality is this is healthy competition for really good legislation and policy to be passed that ultimately serves our constituents in a very productive manner. And so I really enjoy when I have the opportunity to hear what's happening in other states, what's happening around the country. And that only happens with collaboration. And so I am grateful to be invited here so that all of us can, like, now moving forward, stay connected and certainly reach out to me, in the years ahead. Our session will go until September, but we always have a lot of legislation we introduce every year in this space as well. But again, we get the ideas from all of you. And from those that, sometimes there are barriers and obstacles. As I was mentioning, I didn't know until an organization reached out to me back in 2018 about the complexity of the Advanced Healthcare Directive and how it was, kind of depressing the amount of organ donors. And similarly, with this year's legislation, I wouldn't have known if it wasn't for people that had lived experiences coming to me and saying, you know what, we're making it harder for people to make the choice to be a living organ donor. And so I think that I would just encourage everyone to continue your work because it's making a huge difference in people's lives. And, you're the ones that, sometimes, we're the mouthpiece for it in the moment because we have a bill, what have you. But at the end of the day, it happens because of those of you out in the community that are informing me and other legislators on what needs to be done to improve the process and ultimately save lives.
Yeah. I just wanted to pop in share a comment that was in, but I think is worth being read. Lisa Bonebrick, who's a California resident, is talking about the different ages for kidney disease, right? And in fact, Gil and I have a friend who he was a Berkeley police officer. His son got a transplant at about the same age as Lisa's son in 19. And frankly, what is awesome about that is not the illness, it's the survival. That we've got, medicine has advanced to a place where people can get a new kidney and go back to work and have a vibrant life and contribute instead of being sick their entire lives, or, God forbid, an entire short life. So what the representative and the assembly member are doing to reduce the barriers to transplants is tremendous in terms of restoring people to life. And, Lisa's son is just 3 months out from his transplant, but it sounds like doing really well, and that's wonderful. Our friend, his son is we invited him to join. He's a third-year law student and just too damn busy. And it's like, that's great. We are glad you are too busy to join our panel, because that's just amazing to have people come back in such a robust way. So Lisa, thank you for sharing that story, and we will connect you with both Deborah and the Assembly Member Kalra so that you can directly advocate, because I think that'll be huge. And I'd love to pass it back to Nathaniel and Deborah. So thanks for letting us insert a little bit more patient context to this.
Yeah, thank you. Thank you both, Assembly Member Kalra and Rep. Titone. I really appreciate it. Thank you not only for leading on these issues, but for your public service. It's critical. So thank you. You're welcome to stick around for this conversation with everybody else and to field some questions if we've got them. And I see you've all put your emails in the chat. So I hope the audience feels okay reaching out to you. Deborah, I wanted to chat with you. Obviously, we've talked a lot about state level work that's going on. You handle federal issues and you've got an eye on Congress. What's moving through through Congress, in terms of kidney legislation? Could you talk a little bit about the overview and maybe if there's ways that we can engage there as well?
Absolutely. We've talked a lot about Living Donor Protection Act bills on the state. And actually yesterday, the American Kidney Fund just released our state report card. I was excited to hear Assemblymember Kalra talk about state competition. And because of the advocacy of people who are on the panel and the work that we've done, 4 states have increased their score in the Living Donor Protection Act report card, which means that they have enacted more legislation to protect living donors. But on the federal level, there is a federal Living Donor Protection Act bill, and it would essentially serve as a floor. A lot of the states have done more than the provisions in the federal bill. The federal bill includes the non-discrimination in life insurance, disability, and long-term care insurance. It would also codify a 2018 Department of Labor opinion letter that said that people who take time off from work to donate an organ would have protections under the Family Medical Leave Act. And then it calls for HHS to update their website and brochures, just because on so many closed Facebook pages, people are talking about donating an organ, this issue of discrimination in life insurance comes up a lot. So updating the HHS website, so it's something that everybody can point to make sure they know. So that bill currently has 108 co-sponsors in the House, and it has 33 in the Senate. And we're hopeful that we can get it enacted this year. 2 things that have happened this Congress that haven't happened in previous Congresses: the federal version of the state bills have been introduced in the last 3 Congresses. So we're now in the 117th Congress, but what's new is that the life insurers have actually signed on in support of the federal bill. So the kidney community has always been very supportive of the bill. Getting the life insurers to be supportive of the bill too is another step. And also when we talk about the support of states, it is important. And the National Council of Insurance Legislators, who are the state legislators, they meet quarterly to talk about insurance legislation, because insurance legislation is complicated. Last year, April of 2021, the state legislators actually passed a resolution in support of the federal bill. So since life insurance is regulated and legislated on a state level, there has been some concerns about having federal legislation on this issue. But the fact that NCOIL, the state legislators, insurance legislators, are supportive of the federal bill, we think that our coalition of support is well-rounded now. So we're really hoping we can get this done this year and enact the federal legislation. If you go, you can send an email to your legislators through the American Kidney Fund's website. It's www.kidneyfund.com/advocacy, and you sign up and you can send an email to your legislator, to your federal legislator, through our website. So I can stop there to see if there's any questions, or I can talk about the Medigap bill as well.
I would love to hear about Medigap. I just want to insert, Lisa put in the chat, I think something that we've all experienced, right, is that federal legislation can often preempt a lot of the issues that patients have at the state level. And so focusing on the federal level is something that's really promising. And I love hearing that the life insurers, are on board as well. That's huge. So thanks for sharing that. So Medigap, that's an issue that the Chronic Disease Coalition is actually engaging heavier on this year and plans to in the coming years as well. And I know it impacts the kidney community specifically. So I'd love to open it up to that issue.
Okay, great. Well, we talked about Medicare beneficiaries under the age of 65. Once people are on dialysis, they're eligible for Medicare in most situations. But there is an issue with Medigap. The way that federal law was created is that all of the consumer protections for Medigap basically are for people who age into the system. So they start at age 65. For Medigap, and just to take a step back, Medigap is Medicare supplemental insurance. It was created to fill the gaps that traditional Medicare fee-for-service doesn't cover. So Medicare Part B is the outpatient portion of Medicare, and it pays 80%. The patient has to pay 20%. So when you think of dialysis and you have to go, if you go in center, it's 3 times a week, the patient has to pay 20%. It's a co-insurance. If you can get a Medigap, which is Medicare supplemental, it will pay that part that Medicare doesn't pay. And there's 11 different Medigap plans that have been created, but it's private insurance that works with Medicare. And for people under the age of 65 who have ESRD and have Medicare as their primary insurance, it is left up to the states to require or not require Medigap insurers to offer those plans to people who are Medicare beneficiaries with ESRD under the age of 65. And in 20 states now, they are not required to offer those plans to ESRD patients who are under the age of 65. There's bill, it's HR 1676. It is the Jack Reynolds Memorial Medigap Expansion Act. It's a very simple bill. It would require Medigap insurers that are currently in the states and currently offer plans to Medicare beneficiaries age 65 and older. It would require them to offer plans to those who are under age 65. So that is, a bill that we've been working really hard on, and we are still collecting co-sponsors, and we could use some more advocacy on that as well. So the state policy is so important because the states can expand it on their own, or if there's that change in federal law, then all states would require Medigap plans to be offered.
Great, thank you, Deborah. Nathaniel, did you have any more policy questions? Because I kind of go back to Gil and Elizabeth for a minute.
Yeah, absolutely. I'll just say thanks to Kelly Goss with Dialysis Patient Citizens. Their organization has done a lot of extensive research on the Medigap issue state by state, and she put a link in the chat to look up how the coverage is in your state. So I just encourage folks to follow that.
Also, just a quick shout out to Dialysis Patient Citizens. They also did a cost analysis which showed that expanding Medigap would save Medicare dollars. And that is really important to some legislators that we talk to. So thank you for that.
Absolutely.
That is great. Thank you. We talked at the very beginning a little bit about sort of the disparate indicators in terms of communities who are more likely to encounter kidney disease. And actually, that's where Gil and my conversation initially started. One of the struggles for him when he had kidney failure, needed to find a kidney, was that, it's much, much harder to find a good match within minority communities. So I was wondering, Gil, if you could talk a little bit about the kidney transplant challenges. And I'm actually kind of wondering, and I'm sorry that we lost him, but did Assemblymember Kaldra's work on simplifying the donor paperwork? I mean, does even stuff like that help,
I think for donors, wherever we can get people to sign up through their local DMV or however the state identifies donors, making it simpler will make it easier. Because cadaver donors are usually a result of some traumatic accident where they find out that the patient who died or is going to die is willing to donate the organs. They need to figure that out quickly. So making that process easier helps move the potential donors' organs into the system. I think an aspect of being an Asian American, one of the things that I discovered is that from the Asian population, especially if you're first or second generation American, the Asian culture wants you to go to your afterlife with your whole body. And the example of my kidney donor, my friend, who's first generation American, when he told his aunt that he was going to donate his kidney to me, his aunt hung up on him because she thought that he was making a grave mistake, because when he does go into the afterlife, he wasn't going there with all his body parts. So this is an education piece that we need to do with our Asian communities to share and understand or educate that they're saving lives, and you're saving friends, or you're saving families, and that you can actually live a long life, a full life, if you donate a kidney. So that's an aspect why I was willing to share our story, was that it works if we get people to become donors, especially in underrepresented communities.
Gil, was part of, or is part of that for at least Asian communities, a distrust of the healthcare system as well? Does that play in sort of the Western system?
You know, I'm not sure whether or not their distrust of Western medicine plays an effect. It's more of a belief system, because we do have a lot of Chinese cultures that we do throughout the new year, or when somebody dies, that we pay a lot of attention to. And it's just the exposure and understanding. And they don't have, especially if they're first or second generation or first generation immigrants, they don't know about the science and how it impacts people who are sick, and how we could save each other as a community, as humans. So that's, I think, what we need to do is really educate them about that. And the only time that people will get educated from Asian communities is when their own is impacted.
Yeah, and I think Peter was able to bring his aunt around after a while, right? When she understood what it would mean.
I think after explaining that he was saving a life, and my donor, given his history as a lifesaver, he's the ultimate caretaker. He saved my life, and I mean, I don't know how to pay back, that gift. That's the ultimate gift that you can get when someone makes a donation, a kidney donation.
Thank you. Elizabeth, and you could speak to this too with your long history of advocacy and caring for patients. Do you see struggles that are sort of community-based, or that are unique to different communities and different individuals within those communities, in terms of, where you started, like preventative care, diet choices, and then accessing physician attention, right? And getting all the right, screenings, and asking all those right questions. What are you seeing happen?
What I see, Mary Kay, is in my community, there needs to be education on the part of the patient and also the physician, because I work closely with many physicians, and I've done it for years on a volunteer basis, serving on different communities. I've done a lot of community service work over the years, and I've sat on committees with organizations dealing with healthcare professionals. And a lot of them are dealing with personal biases. A lot of them don't keep up to date with the various changes in medicine. And they have a preconceived idea that, well, they're not going to be compliant anyway, so why waste my time talking to them? And then on the patient's aspect, a lot of them are distrustful of their culture. The culture leads them to say, well, I feel okay. There's no reason for me to see the doctor. There's a fear because they don't want to find out if something is wrong. And so there needs to be more awareness and education all around.
That's great. Thank you. And you sort of raised an issue for me too about sort of the delayed care question, and not going when you feel fine. You feel fine, and you can postpone some of that stuff a little bit too long. And I think as we come out of COVID, we have to give each other a little nudge on getting some of that preventative care, and knowing your numbers is such a huge thing, right? Knowing your blood pressure numbers, managing hypertension, understanding the impact of sodium. I mean, Deborah talked about the recipe library that they have, utilizing things that are freely available, even without physician
Right.
interference. What resources did you find to be helpful, or do you find to be helpful when you talk to other patients?
When I talk to other patients, I do a lot of volunteer work here. I use food as an opener because for many years, I volunteered with the food bank here. And over the years, we saw the demographics change. So a food challenge is affecting most families here in America. So what I do is through the food bank, we deliver boxes of food to the dialysis centers. And it's easy to establish a relationship with people because you're giving them something. You're not asking for anything. And when you come in with something, they are the focus. The focus is on them, not on you. And they open up, and it's heartbreaking. I hear people say, well, every time I went to the doctor, I had a different doctor. And, they told me a long time ago I could get a transplant, but they never mention it again. People are powerless. And that's a huge factor.
It is a huge factor. Deborah, I don't mean to put you on the spot, but I know that both Kidney Foundation and you have equity programs that address some of this. Can you speak to that at all off the top of your head, or can we put some resources in the chat?
The American Kidney Fund, our programs. I can put some in the spot, but so we have programs that we have direct financial assistance grants. We do natural disasters. If there's a natural disaster, we open up a fund to help the dialysis patients in a natural disaster. We also have our charitable premium assistance program, where we help low-income dialysis patients pay for their health insurance, and then we pay up to a year after they've had a transplant. Are those some of the programs you were asking about?
That's absolutely helpful. Things that anybody can access to get better care and reduce the burden of healthcare, which can be so considerable. Well, I want to recognize folks' time that we're at noon. So first, I'm going to open up to the panelists and allow you to make closing statements, anything that we didn't get to. And then for folks who are watching, if you have any last questions, you ask your questions. We'll let the panelists close out, and then we'll wrap up. How about if we start in the order that we went? Elizabeth, is there anything that you want to add?
I would just like to add that people need to really guard their health, especially with COVID on the scene.
Yeah, that is 100% true. Thank you. Gil?
I want to thank the coalition for this opportunity to share my story, and the American Kidney Foundation for the information that you're providing. I want to give you a story that on Nextdoor, it's a local neighborhood app. I saw somebody soliciting a GoFundMe for a patient who's trying to get a kidney donation. And the reason why they're asking for support is they don't have the money to pay for the medications that's after the transplant. So I'm going to connect this family with your foundation to see if anything can be done for this particular family.
That's actually an interesting just point. Also, yeah, absolutely, have them email me. But also, without a supplemental insurance, dialysis patients will not be accepted to a transplant waiting list, because Medicare only is not considered fully insured. So issues like, so you need to be fully insured, which is another reason why access to Medigap is so important.
Yeah, great. Thanks, Deborah. Anything else? There's some really good resources that are now in the chat. We've got some American Kidney Fund resources. I also put in Register Me so that if you are not already registered, you can donate and share that with others as well. And then we've got a couple of other places where you can just sort of stay informed. We update our website on a regular basis. We use social media a lot. We work across the country in lots of different states. And so we provide national information through our social media channels and use our newsletters and specific outreach so that folks know what's happening in their state. So you can follow us, you can subscribe to our newsletter, and you can also just let us know what you think about this as a format and where else we could help provide education and activation opportunities. Chronic University, which is what we call this kind of panel, is an important part of our patient education work. And we want your feedback about how we can make things better. We'll post the entire video on our website. You'll see clips and quotes throughout on our social media feeds, our newsletters, stuff like that. But if there's topics that you want to explore or learning formats you prefer, any other ideas, please share them with us. We got started with this last year, and frankly, everybody is, most states are opening up. Even my very, very slow to open state of Washington is allowing people outside again. And so we're just not spending as much time in front of the computer as we did in the pandemic. And so as folks come untethered a little bit from this, we still want to be able to reach people with activation opportunities and education opportunities. So if you see other people doing work that you like and that you do pay attention to, let us know, or just help be part of our process. And I really, really appreciate and Nathaniel will join me in this. Everybody's time on this has just really been extraordinary. Cannot thank you enough.
Yeah, I'll just echo Mary Kay. I mean, it's just incredibly important, to be spreading awareness, sharing your experience. Both our elected officials talked about the importance of lived experience informing public policy decisions, and I just think that hits the nail on the head. And really appreciate you all, sharing your perspectives today, and very much looking forward to working with you, coming up. So thank you.
Thank you.
Yeah, I'd say the main thing that I take away from these is that we're not alone. We're not alone in our struggle as patients. We're not alone in our struggle to make laws more fair for everybody. We're not alone in our community-specific struggles. So again, really appreciate everybody's time. It was a great conversation. I'm so grateful to have participated. So thanks, everybody, and we'll close out. Have a wonderful rest of your Thursday. Bye.
Thank you.
Bye.
Thanks, everybody.
Bye.